Starting with Mr. Edwards on the opioid crisis, it continues to devastate our state, but federal help has been flowing into the state as far as grants or other resources. So what specific program do you think is working and what do you think is not working?
Well, this is, again, a lot of an area I have a great deal of experience in. I was known as I was certified as a DRE, which is a drug recognition expert instructor. So I've trained police officers in 23 different states. Saw this developing right here. We knew that the opioid crisis was coming in law enforcement maybe 10, 12 years ago. And we began to talk about the number of people coming through these evaluations night, we call them, who are on prescription medication. So when I look at New Hampshire, we've been disproportionately impacted. And this is a heavy burden for taxpayers. So I think we have to turn back to the pharmaceutical companies and ask them to pay more into relieving the taxpayers of this burden. When you start to look at some of the pharmaceutical tactics used to promote prescription opiates, I think we have to go back and hold people accountable to that. And our AG's office here has sued some of the companies, and you're seeing prosecutions of some of the other folks who were prescribing opiates. But for me, this goes back to prevention and education. So if we start to educate our doctors, patients, moms and dads, I think we're going to be pretty good here. Cops are going to do what we always do in law enforcement. We're going to arrest the bad guy, but we need more in the area of prevention and recovery and treatment.
And Mr. Pappas, one thing that's working, one thing that's not working with the opioid crisis.
This has to be a sustained focus of ours, not just over months and years, but over decades and a lifetime. Because when someone's in recovery, they're there for a lifetime. Our delegation's done some important work working across the aisle to get results and to leverage some more funding for New Hampshire. We're going to invest that to build out a hub and spoke model that's going to allow for more access points around the state of New Hampshire, increase the availability of treatment and recovery opportunities for individuals. That's critically important. One thing we're not doing a good enough job doing right now is measuring outcomes. And so I believe with this additional funding, we'll be able to better assess where the dollars are best spent, where they're most making a difference. It's also important that people have health care. And the best tool we have to fight the opioid crisis is Medicaid expansion. I was proud to provide the pivotal support to implement that program, which now covers 53,000 individuals in our state. Unfortunately, my opponent would have voted against it back in 2014 when Republicans and Democrats came together to craft that solution. So that's just one thing that is working for the people of New Hampshire. We need to continue to insist on more resources to invest in strategies that hold the promise of allowing us to turn the corner on this.
Mr. Edwards, you've been invoked. You can respond.
Sure. I mean, I think it's pretty clear that the taxpayers can't catch a break with Chris. They can't. That entire rant description did not talk about the irresponsibility of the pharmaceutical companies that created this problem and holding them accountable. Then he turns to more government, where he wants a socialized medicine program, a Medicare for all program, that's going to cost this country trillions of dollars. It's going to bankrupt this country. And he won't be honest about this. And he won't tell you how he's going to pay for it. He just wants more government. He can't imagine a system where the free market is involved and we actually hold people accountable without government being involved.
Mr. Pappas, you can respond.
Well, I don't support that, but something I have supported at the state level was giving our Attorney General the ability to go after the drug manufacturers for mismarketing, and they have, and they've been successful at it, and we've invested some more money in prevention because of it. So I think that's what we have to do at the state and federal level, hold people accountable, make sure that we can win some settlements to invest them into prevention and recovery and treatment. I would look for ways to do that at the federal level.
One quick follow-up here. Mr. Edwards, do you believe that opioid addiction is strictly a disease, or do willpower and morals play any kind of role?
Well, I think it's very clear from the people I've interacted with who are become addicted to this. This is something that people become addicted to. I don't think you just have willpower to overcome a medical, chemical and change system within your human structure. So I definitely believe that this is something that should be addressed and taken very seriously. I don't think this is a moral issue. I think the way we have engaged in this process and gotten here, though, has to do with that. Has to do with a lack of accountability.
Mr. Pappas, if it is a disease and addicts aren't responsible for their behavior towards drugs, how can they be held responsible for crimes?
Well, substance use disorder is a medical disorder, and we have to work to destigmatize it so that individuals can get the care that they need. Individuals have to want to receive the treatment, and that's certainly a part of the challenge that we're facing right now. We have to make sure that they're there at the right time and have access to treatment and services. That's part of the challenge in addressing the opioid crisis head on.